Welcome to another practice question video. At the end of the video, check out the description for studying resources and more. Practicing nursing questions frequently is the best way to pass many nursing exams. Now let's begin. Starting with question 1. A primipara diagnosed with cystitis at 48 hours postpartum who is receiving intravenous ampicillin asks the nurse, "Can I still continue to breastfeed my baby?" Which of the following responses by the nurse would be most appropriate? You can continue to breastfeed as long as you want to do so. Alternate your breastfeeding with formula until the antibiotic therapy is stopped. You'll need to discontinue breastfeeding with formula until the antibiotic therapy is stopped. You'll need to modify your technique by manually pumping your breast. The answer is you can continue to breastfeed as long as you want to do so. The client can continue to breastfeed as often as she desires. Continuation of breastfeeding is limited only by the client's discomfort or malaise. Drugs such as sulfonamides, nitrofurantoin, and cephalosporins usually are not prescribed for breastfeeding mothers. Clients with heart failure are prone to atrial fibrillation. During physical assessment, the nurse would suspect atrial fibrillation when palpation of the radial pulse reveals 2 regular beats followed by 1 irregular beat. An irregular pulse rhythm. Pulse rate below 60 bpm. A weak, thready pulse. The answer is an irregular pulse rhythm. Characteristics of atrial fibrillation include pulse greater than 100 bpm, totally irregular rhythm and no definite P waves on the ECG. During assessment, the nurse is likely to note the irregular rate and should report it to the physician. A weak, thready pulse are characteristics of a client in shock. When teaching the child with scoliosis being treated with Boston brace about exercises, the nurse explains that the exercises are performed primarily for which of the following purposes: to decrease muscle spasms, to improve the brace's traction effect, to prevent spinal contracture, to strengthen the back and abdominal muscles. The answer is to strengthen the back and abdominal muscles. Exercises are prescribed for the child with scoliosis wearing Boston brace to help strengthen spinal and abdominal muscles and provide support. Typically, children wearing a Boston brace do not complain of muscle spasms. Performing exercises provides no effect on the brace's traction ability. Spinal contractures do not occur when a Boston brace is worn. The nurse is preparing a teaching plan for community presentation on the prevention and early detection of colon cancer. Which of the following would the nurse identify to the audience as the most common symptom of colon cancer? Abdominal pain, diarrhea, rectal bleeding, abdominal distension. The answer is rectal bleeding. Rectal bleeding is the most common symptom of colon cancer. Other commonly seen symptoms include alternating constipation and diarrhea, narrowing of the stool caliber, and a sense of incomplete evacuation. A married woman has been referred to the mental health center because she is depressed. The nurse notices bruises on her upper arms and asks about them. After denying any problems, the client starts to cry and says, "He didn't really mean to hurt me, but I hate the kids to see this. I'm so worried about them." Which of the following would be the most crucial information for the nurse to determine? The type and extent of abuse occurring in the family. The potential of immediate danger to the client and her children. The resources available to the client. Whether the client wants to be separated from her husband. The answer is the potential of immediate danger to the client and her children. Safety of the client and her children is the most immediate concern. If there is immediate danger, action must be taken to protect them. When assessing a client for early septic shock, the nurse observes for which of the following: cool, clammy skin, warm, flushed skin, decreased systolic blood pressure, hemorrhage. The answer is warm, flushed skin. Warm, flushed skin from high cardiac output with vasodilation occurs in warm shock or the hyperdynamic phase of septic shock. Other signs and symptoms of early septic shock include fever with restlessness and confusion. The nurse is conducting a postoperative assessment of a client on the first day after renal surgery. Which of the following findings would be most important for the nurse to report to the physician? Temperature of 99.8 Fahrenheit. Urine output of 20 milliliter per hour. Absence of bowel sounds. 2 by 2 inch area or serious sanguineous drainage on the flank dressing. The answer is urine output of 20 milliliter per hour. A decrease in urine output may reflect inadequate renal perfusion and should be reported immediately. Urine output of 30 milliliter per hour or greater is considered acceptable. When developing the plan of care for a client during the acute phase of rheumatoid arthritis, which of the following would the nurse identify as the lowest priority? Relieving pain. Reserving joint function. Maintaining usual ways of accomplishing tasks. Preventing joint deformity. The correct answer is maintaining usual ways of accomplishing tasks. Maintaining usual ways of accomplishing tasks would be the lowest priority during the acute phases. Rather than focus is on developing less stressful ways of accomplishing routine tasks. The physician has ordered prostaglandin gel to be administered vaginally to a newly admitted primogravid client. Which of the following would indicate to the nurse that the client has had a therapeutic response to the medication? Resting period of 2 minutes between contraction. Normal patellar and elbow reflexes for the past 2 hours. Softening of the cervix and beginning effacement. Leaking of clean amniotic fluid in small amounts. The answer is softening of the cervix and beginning effacement. Prostaglandin gel may be used for cervical ripening before the induction of labor with oxytocin. It is usually administered by catheter or suppository or by vaginal insertion. 2 or 3 doses are usually needed to begin the softening process. Which are the following measures would the nurse expect to include in the teaching plan for a multiparous client who delivered 24 hours ago and is receiving intravenous antibiotic therapy for cystitis? Limiting fluid intake to 1 L daily to prevent overload. Emptying the bladder every 2 to 4 hours while awake. Washing the perineum with provolone iodine, betadine, after voiding. Avoiding the intake of acidic fruit juices until the treatment is discontinued. The answer is emptying the bladder every 2 to 4 hours while awake. The client diagnosed with cystitis needs to void every 2 to 4 hours while awake to keep her bladder empty. In addition, she should maintain adequate fluid intake. 3,000 milliliter per day is recommended. Well, that's it with this video. See you next week for another set of questions. Leave a comment saying how many you got correct.